Let's move here into our second learning objective, and this is to understand the partial pressures that exist in the alveoli and the blood and the consequent effect on gas exchange. This is our oxygen cascade, excuse me. So the partial pressures that exist in the alveoli, in the blood, and how that gradient that is created drives gas exchange, drives the movement of these gases throughout our circulatory system and eventually across our capillary beds to allow for gas exchange. So in order to think about the exchange of our gases, we want to think about the factors affecting that here. So the gas exchange that happens in the lungs between the air in the alveolus and the dissolved form of that air in the lungs, right, in the capillaries. We also want to think about the gas exchange happening in the respiring tissues. So out at the level of our systemic capillary beds, the gas exchange happening there as well between the gas existing in the tissue form, right, within the tissue level, as well as that that's dissolved in the blood. And then we also want to think about determinants of our partial pressures, our alveolar partial pressures of oxygen and CO2. So what are the factors that affect partial pressures of these two gases in the alveolus, right? Because that certainly will determine our gradient and therefore determine our gas exchange. So let's describe the factors that cause diffusion. And it's not any different from what we described in the circulatory system. In order for gases to move, there needs to be a gradient. So gases move down their individual partial pressure gradients from high partial pressure to low partial pressure because remember, if we look at the gas individually, we only think about its partial pressure. But because these gases are combined in this overall gas mixture, now we have to sort of individualize them and look at their individual partial pressures. And so that is what will determine their movement. So I say this to say that in our blood, we have both gases. We have CO2, we have oxygen. So what is determining the direction of movement for the gases independently is their individual partial pressure. This is why CO2 and oxygen, although they're both mixed up in the same a liquid form in the blood and in the air in the alveolus, they're not moving in the same direction because they have their own individual partial pressures that guide their partial pressure gradient that will help them to determine in what direction they move. All right. So the partial pressure gas will move down its own partial pressure gradient. Excuse me, the individual gas will diffuse down its own partial pressure gradient, and it is going to move irregardless of the partial pressures of the other gases that are diffused in that same medium, whether air or whether it's in the blood. Okay, let's reiterate that here again. So thinking about our atmospheric pressure, the air here in our atmosphere being for oxygen partial pressure 160, for CO2 zero 0.3. And then when we get down to the level of the alveolus, the alveolar air, we already see a drop off. So the partial pressure of oxygen is now 100, partial pressure of CO2 is 40. It's actually increased. So notice how the individual partial pressures are different, although it's the same gas mixture, but they each have their own separate partial pressures that will determine their partial pressure gradients and the direction of movement. So oxygen is going to move down its gradient from a place of high concentration, 160, to lower partial pressure, which is 100. So oxygen will diffuse from the atmospheric air across or down to the alveolus, okay? And then CO2 will move in the opposite direction. CO2 is higher in the alveolus, lower in the atmospheric air, and so it will move out into the opposite direction based upon its individual partial pressure. And then we can also compare between the alveolar air and the cellular level, the systemic capillaries. We're also going to find a gradient existing across these two areas as well. So for oxygen, we have a high partial pressure of oxygen, 100, At the level of the cellular tissues, we have a partial pressure of oxygen at 40. So again, we have a gradient from high to low, which drives oxygen movement in that direction. The opposite exists for CO2. We have a partial pressure of CO2 at 46 at the tissue capillary beds, and then it is at 40 in the alveolus, which drives oxygen movement in the opposite direction, from high at the tissue level to low at the alveolar level, and then even lower out here at the atmosphere. So these individual partial pressures are essentially driving the movement of the gases in opposite directions based upon their individual gradients. And this phenomenon is described as the oxygen cascade. So the way that the partial pressure is dropping off at every level, from the atmosphere to the alveolar air, to the pulmonary vasculature, to the systemic capillaries, and then eventually the capillary beds, that is described as the cascade that allows for diffusion. Okay. We also want to think about the diffusion barrier here. These are also going to affect the diffusion between the alveolar and the blood. And because we have a small diffusion barrier, which means that we have a very thin membrane, because of those three structures we described, the very thin epithelial, endothelial layers, and the fused basement membrane, we have a rapid diffusion between these two areas. The other thing that causes the rapid diffusion is the large surface area. So we have extensive, branching of the alveoli. We have extensive surface area because of the pulmonary capillaries covering the surfaces of those alveoli. So that gives a lot of surface area to work with, which we know increases the diffusion rate and the amount of exchange. So let's talk about how these gases move across the capillaries, right? Let's kind of illustrate that here. So we're comparing the partial pressure of the gas. We're looking at oxygen first. Partial pressure of the gas here on the Y, and we're comparing that to the length of the capillary, right, in the percent. So what percentage of the capillary have we moved across in order to see the movement of these gases? So basically we have our mixed venous partial pressure here at about 40, which is lower in our venous blood. So the partial pressure of oxygen is lower in the venous blood. Up here at the level of the pulmonary capillary, it's about 100 millimeters of mercury. So as the blood moves across the length of the pulmonary capillary, when it gets to about 33% of the overall length, we see that all the gas has already exchanged, has diffused. All right. And now we no longer have a gradient. The partial pressure has changed because the gas itself is diffusing. So it goes from 40 millimeters of mercury to 100 millimeters of mercury. All the gas that can be moved has already moved when we're only at 33% of the length of that capillary. And now we have equilibrium. So the partial pressure here is the same as it is in the alveolus, and we no longer have a gradient for movement. So this levels off or flattens off for the rest of the length of the capillary. Let's compare the same type of movement along the length of the capillary in the opposite direction. This is now looking at CO2. So similarly, we're looking at the partial pressure of CO2 here. It goes from 40 in the alveolus, again, we're moving in the opposite direction this time, 40 in the alveolus to 46 in the pulmonary veins, so pulmonary capillaries here. And so we're going to see the same phenomenon, that as we move through the length of the capillary, when we get to about 33%, the overall length, about a third of the way the length of that capillary, we have the complete, diffusion of that CO2 from the mixed venous blood across the alveolus into the alveolar spaces, where all of the gas that can be moved has been moved, and now we are at equilibrium. So the partial pressure of the alveolus is the same as what is in the capillary at a third the way the length, and now we no longer have any diffusion because we have equilibrium between the partial pressures. All right. So for the rest of the length of the capillary, the blood is just flowing. It's no longer having any diffusion. all the diffusion occurs in the first third, the length of the capillary. All right. I'm going to pause here because we're going to get into the individual partial pressure gradients. We're going to talk about the numbers and calculations here. And I want to be able to have time to really reinforce this. So let's pause here for today, digest some of what we described so far, and then please let me know any questions you have. You can put them in the chat box now, or you can bring them to class next time we meet. But so far, we've been talking about the factors that affect diffusion, the partial pressures of the gas. We've described what those partial pressures are. We've described the solubility, what determines the movement of those gases and how the solubility differs for CO2 and oxygen. And then we've also described the oxygen cascade, the partial pressure gradient of our individual gases like oxygen that cause the gases to move in different directions, although they are existing in the same area, right? In the same air or blood for the pulmonary capillaries and the alveolus.